Okay, so we're here with the County Commissioner and Dr. Vagela and Dr. Iqbal Kandwala, the DG and the County Secretary at the Coast General Hospital. Hakuna kuongea sisi, me and the County Commissioner, we're not speaking. We have come here to listen on the level of preparedness on this level. We have done the first one, now we're doing the second one. So we want the doctors to tell us what they have done. Karibu, Iqbal.
Thank you, Your Excellency. Your Excellency, as we know, we are in a state of preparedness for the pandemic that has gripped the whole world, and Mombasa County has not been spared, and neither has Kenya as a nation. Since the pandemic started in the world, we started our preparations, and at Coast General Hospital, which is now Coast General Teaching and Referral Hospital, we have tried to prepare ourselves. And initially we started with an 18-bed isolation ward at Ramtula, which as we speak today is full. We had already started planning, and we have actually taken out a section of the hospital to become a total COVID medical center, or a total COVID hospital, 150 bed, which is totally prepared with about 60 beds to handle moderate cases of COVID, 30 beds to handle critical care up to ventilatory support. And in this particular setup, we did not forget to arrange the maternity, because we can also have maternal cases that are COVID positive, and we are going to treat them separately in a separate theater, which is only going to be used for COVID maternity, where cesarean sections will be done. And even if there are surgical cases that are COVID, they need to be handled separately, and they're going to be operated on in that particular center. For patients that have any other ailments, let's say psychological patients, psychiatric patients, we are also prepared for that, Your Excellency. And that's why we have created such a center. It's within Coast General, but totally a total separate section where there's going to be no interference, no cross-infection between the normal cases and the cases that come for COVID. We have also, in this particular facility, thought about the staff that may get infected. Of course, we don't want that to happen, but for that we have created also some space where they can be looked into, and we appreciate the county that has come forward and availed to us 64 million shillings to set up this particular center the way it is. As we all know, these number of cases may even increase more than that. So this could be a stopgap as we look into a bigger picture of establishing a 300-bed COVID field hospital at Technical University of Mombasa. So I want to appreciate His Excellency, his site, and him pushing us towards getting us prepared. And I think, Your Excellency, we have tried to respond, but we could not have done it without the establishment of our Coast General Teaching and Referral Hospital, the COVID response team, for which Dr. Vagela is the chair. So up to this level, Your Excellency, I can comfortably say that we are prepared, and we are ready to go. By tomorrow, I believe we will also start admitting patients in this particular center. Thank you very much.
How many ICU beds and stuff like that? You can use that one. We're observing safety standards.
Good afternoon, everybody. Thank you very much, Your Excellency and the Mombasa County team. On behalf of my Chief Executive Officer, Dr. Kandwala, I would just like to say that we as Coast General Teaching and Referral Hospital and part of the COVID-19, the SARS-CoV-19 team, which myself with my colleagues, we are part of it, I'm chairing it. We have at the moment organized this Lady Greek, which is part and parcel of the CGTRH. We have about 150 beds, of which 24 are dedicated ICU beds, all ready at the moment. Should we get severe COVID cases who needs immediate intubation, ventilation, we are ready. Our anesthetists team, our physicians team, we are all on board, and we can admit them even now as we speak. Then we have further about 90 beds, of which we have divided amongst males and females, and will be accommodating the mild to moderate cases of COVID patients. And they are all going to be housed within this Lady Greek building. and we have also segregated them adequately as to how we need to accommodate these patients, admit them, manage them accordingly, and should they change condition, should they become from mild to moderate, from moderate to severe, they will be accordingly managed by our clinicians. Notwithstanding the fact that we have also looked into our pediatrics, the children, we have also dedicated space for them, as well as persons with disabilities or special needs, psychiatric patients, all of them we have tried our best to try and accommodate them as we kind of go through this pandemic, which you know is hitting world over. And of course there is room for further expansion. Only thing is, at the moment, as we set off with this, we know through the county that we are organizing the Technical University of Mombasa, where we have further expansion plans as well to set up more beds. And none of this would of course be possible had it not been through my CEO and of course the support of the county, as you rightly heard from our CEO, that we are where we are today, and we will need everyone's support to go through this pandemic. Thank you.
Maybe on behalf of the committee, County Commissioner will say something to Fungi. Sure, just to thank the doctor.
Thank you very much. I will be very brief. On behalf of our committee, our Preparedness Committee for Mombasa, I'm very grateful to all our medics, and particularly to the county government of Mombasa for the preparedness which has been put in place. I'm also very grateful to the well-wishers who have donated the various machines which are available in this hospital, and these ones will go a long way in assisting our people. Otherwise, kudos to everybody who is working with us towards this end. Asanteni sana. Thank you.
Asanteni, let us now get prepared for mass testing. Silvio, yes. You assured us that mass testing will begin soon. So now let us prepare ourselves for mass testing. Na tukipata mgonjwa mumlete hapa tuanze kumtibu. Sivyo? Asanteni.